Hello, good evening, friends. I hope you all are fine and much of your anxiety must be relieved by the recent developments. So, we will talk about this 2022 in our second half, as I mentioned. Now, first come to the NEET PG 2023. So postponement in it is still not in horizon, but the murmurs which is taking place in corridor that probably you will get a 3 week suspension or 3 week postponement, not more than that. So it is fourth week of January as of now, and if we believe the murmurs, then it may be not more than 3 week postponement. So this is about NEET PG 2023, and that is going to happen. Examination of NEET PG 2023 is going to happen. No need to worry. No need to worry about the timings, when they will announce the details and everything. Whatever it is, your exam is going to take place before next. Because after NEET PG 2023, next exam is online, but serious questions are on next examination, not on the NEET PG 2023 examination. Last in last video assisted video directed for your assistance for the NEET PG 2023, I have posted the questions on ophthalmology and ENT and the study material. So I have posted the answers, detailed answers on that same video in their description box. So you can download those answers and go through with the answers, and you can check at what level your preparations are. Uh, you must have noticed that these integrated questions are meant for keep you thinking in all directions, so that you will come to a conclusion which is in interest of the patients, because in day to day life you will get these type of scenarios. Remember, when you entered into the medical college, you study anatomy, physiology, and biochemistry, but and then thereafter you start going to clinics. So one thing which is added to you is stethoscope, and stethoscope is your all-weather friend which will be carry along with your life. So what is the use of a stethoscope? So most of the people will say, okay, we'll do use in cardiac auscultation or in auscultation of lung sounds. So, but primarily, the stethoscope used for the confirmation of our finding of blood pressure recordings. So, it is used to measure the blood pressure, and when you measure a blood pressure, you will find many answers. And stethoscope, why stethoscope is your all-weather friend? When we were studying in medical college, our professor or a one I say assistant professor that time used to take blood pressure and used to do auscultation of each and every patient irrespective of the complaint. So it was a very curious question, and one day I asked him, "Sir, this is a clear-cut case in which you can make this diagnosis, but why you did auscultation of lungs, is chest, and you took the blood pressure also?" Then he told me that when I use this stethoscope and touching the patient, that is not meant for any diagnosis or anything. That is mainly meant for making a relationship with that patient, so that patient trust relationship can be built, and built upon that, we can go further, and whatever I will prescribe, patient will follow, and then I will get more success. So that's why the integrated questions were composed in such a way that you will think about this. For example, if you have noticed in ophthalmology series question that ophthalmology questions, most of the time in examination you will find trachoma in old age questions, in later age questions, rarely in a child, and that's a young child, you will find a question based on trachoma. So here we are committing a mistake. We are going for the different diagnosis because we think this is not a case of trachoma because this is a very young child. But this is not the case. But why? Because in exam, in your question itself, the some symptoms are given, some signs are given, which is classic to that disease. So you have to check the words, and you have to go through those words, then find the answer accordingly. So don't confused by such gimmicks, which is very common is age. Age is a most common factor by which you may attempt a question wrong. So purpose of twisting the age in the question, and so that you will get acquainted, okay, how the question can be built, so that your every question will be corrected. Second thing is, always think a common thing. What is the common? For example, if in any question they ask about some common infections, viral infections, and they give an option the herpes simplex virus, then first think of that. If any symptom matches with the herpes simplex, then answer is always the herpes simplex. Why? Because herpes simplex is living in more than 80% of the world population. It's the most common virus which is present in our body with us, which is not causing a disease. Where in person it will get an opportunity, then it will show the symptom. So herpes simplex is that type of questions are there. I have posted the I think you must have gone through the images in my presentation with ENT and ophthalmology, because in ENT and ophthalmology, in particularly in the ophthalmology, we'll find the image based questions. So image based question needs a direct approach, so that I have posted deliberately posted images in the reading material so that you can go through that one. So that's about the ophthalmology and this one. Now come to the today's thing. So today I have appended a link in description box, which is your first part of the first full syllabus test. So 50 questions are there, and more 50 questions in this series. So you can say part A 50 question of test 1 full syllabus are appended today. Tomorrow or day after tomorrow, I will post 50 more questions. So total of 100 question full syllabus of a test 1, and answers accordingly I will share with you, so that you can go through with these questions. If you will go through with these questions, you will find detailed questions, one liner, and some image based question, which is the pattern of your Neet PG examinations. So these first 50 questions you will find very helpful in the Neet PG, but your first task is INICET examination is approaching. So in next 50 questions, which I'll post tomorrow, I'm trying to post tomorrow evening, otherwise I'll post day after tomorrow morning. So those 50 questions will be more relevant to your upcoming INICET examination in November. And I hope you people who are preparing seriously already have registered for the INICET examinations and filled their form, and their preparation is in full swing. So this is about the Neet PG 2023. So as I mentioned you in the opening remarks that your Neet PG 2023 dates is still 4th January Sunday, but murmurs are in the corridors are postponement for not more than 3 weeks if it is postponement, but still no postponement sort. So but let's see what comes out of that one. So this is about the PG 2023 assistance, and now come to the Neet PG 2022 counseling. Now, as I mentioned from beginning, that you will get 50% seats of private medical colleges from deemed university as well as from your states. You will get it. Don't worry, you will get it. Day before yesterday, I'm not talking about any official confirmation which you send me also, but you people are elated to saw that official. But I am telling you beyond that Kerala High Court judgment is going to be reversed. Supreme Court will revert it. And secondly, the Tamil Nadu High Court decision in which Tamil Nadu have asked NMC to reconsider and issue a fresh instructions. So NMC will issue a fresh instructions to the Tamil Nadu that this is going to implement, because law forming capacity is with the parliament and parliament have passed this. So need not to worry, you will get additional seats at government fees in postgraduate courses as well as undergraduate courses. Issue comes for private medical colleges is for the postgraduate colleges. Why? Because postgraduate fee in all states is very low, and above that the students are getting the honorarium also, the stipend also in a month, which is quite more than their yearly fees. So that's a question. So probably government have given them a option, okay, we will not touch your this option, but as Supreme Court directed, you cannot take these candidate as granted and don't give any stipend, you have to give. So but that is up to you that how much you will give in stipend to all those students. So maybe you will get less stipend but seat at par with the government fees of the state, and maybe you will get the stipend that your expenses, daily expenses will be covered, so that in a layman language you can say you are working in the hospital without any money, generously, just to fulfilling your day-to-day expenses. Second query, which is you are very concerned and very I think keen to know about the number of seat increase. Number of seat increase, LOPs will be issued or issued already, will touch the figure 7340. And don't worry, because you people are looking at the NMC side. Someday you are saying 400 seat, now 600, now 1000. So updatation at the NMC site you will get it. Even after your counseling they will keep doing updatation. Don't worry, the 50% seats of the private medical college and the government increments will touch the 5-digit marks, and private medical colleges increment is also there. So you will be in very good position. So आपको इसमें सीट इंक्रीमेंट को लेके कोई टेंशन करने की आवश्यकता नहीं है. जैसा मैंने आपको कहा है, सीट इंक्रीमेंट आपका चलता रहेगा एनएमसी की वेबसाइट पे. नो इशू इन दैट वन। परंतु आपकी जब काउंसलिंग शुरू होगी और जो काउंसलिंग के जो फिगर्स आएंगे उसके बाद आपको खुद पता लगेगा कि किस में कहाँ कितनी सीट इंक्रीज हुई हैं। अगर आप एनएमसी वेबसाइट की बात करें तो कई स्टेट ऐसे हैं जहां पे आपको प्रैक्टिकली वहां के न्यूज़पेपर से भी पता लग रहा होगा कि यहाँ पे सीट इंक्रीमेंट हो चुकी है इतनी, और लेटर भी आ गए हैं। पर अगर आप जब एनएमसी की वेबसाइट पे जाके उन स्टेट्स को चेक करते हैं तो वहां पे आपको कुछ मिलता नहीं है, तो आपको कंफ्यूजन होता है। कंफ्यूजन करने की आवश्यकता नहीं है, एनएमसी की परमिशन आ चुकी है, और अब तो कॉलेजेस ने अपना रिवर्स जो एनएमसी सॉफ्टवेयर में अपडेट करना होता है वो अपडेटेशन चालू कर चुका है। तो दैट्स द अपडेट ऑन द सीट इंक्रीमेंट साइड। कुछ कॉलेजेस जो जहां पे डीएनबी की सीट्स थी, उन डीएनबी की सीट्स को उन्होंने पोस्ट ग्रेजुएट सीट्स में कन्वर्ट किया है, तो वो सीट्स भी आपकी एमडीएमएस में कन्वर्ट हो गई हैं, तो वो भी आपकी इंक्रीमेंट के अंदर आएंगी। कुछ नई डीएनबीज भी सैंक्शन हुई हैं, तो डीएनबी की सीट इंक्रीमेंट इतना ज्यादा हैंडसम नहीं है जितना आपका एमडीएमएस की सीट्स जो हैं वो इंक्रीमेंट है, क्लिनिकल, पैरा क्लिनिकल और नॉन क्लिनिकल। ये आपके मोस्टली इंक्रीमेंट हैं। एक जो क्वेश्चन है कि क्योंकि ये क्वेश्चन मेरे को आयुष ने भी पूछा था कि सीट इंक्रीमेंट इतना हुआ है, अभी तक इतना ही हुआ है। आयुष जो रेगुलरली आयुष और उसके साथी मेल भेजते रहते हैं कि आज 400 हो गया, आज 600 हो गया। अब आज का मेल उसके हिसाब से 1000 सीट हो चुकी हैं। और अपनी रैंक पे अगर आयुष आप एमडी रेडियोलॉजी ढूंढ रहे हैं तो मॉपअप तक जाइए, आपको मिल जाएगी। कॉलेज कौन सा होगा वो आपको पसंद आपकी देखनी है कि क्या आप उस पसंद के कॉलेज, उस कॉलेज में आप जाके करना चाहेंगे या नहीं करना चाहेंगे। कुछ कश्मीर के स्टूडेंट्स ने मुझे क्वेरी किया था, क्योंकि वो फर्स्ट टाइम, शायद कुछ स्टूडेंट ऑल इंडिया में उनको लग फर्स्ट टाइम वो क्वालिफिकेशन के लिए आ रहे हैं, तो कैसे काउंसलिंग करेंगे, क्या होगा। तो मैंने आपको जैसे बताया था, एज आई टोल्ड यू दैट ऑन द फर्स्ट डे ऑफ चॉइस फिलिंग I will do a live session in the evening time, and I'll demonstrate you how to fill the choices so that you can easily fill the choices, and which will help you to go through the process quite easily. And as I told you in past also, NMC have issued a instructions to all of you. You must have gone through that, and that's a very serious advice to you, because last year you people and the undergraduate people have escaped the penalty, but this time won't. So NMC have issued already a letter instructions which I told you in advance, that you must keep your password and username with you and do not share with anyone. And as soon as you finish with your counseling, just exit from the counseling and change the username or change the password, so that if anybody have that password, then that person won't able to log in. Because if you gave the authority to someone and someone plays with you, or someone did a wrong thing with you, so that may be very costly for all of you. तो इसलिए एनएमसी की जो इस एडवाइजरी है उसको फॉलो करें, और यूजर नेम और पासवर्ड आप किसी के साथ उसको शेयर नहीं करें। तो कश्मीर के स्टूडेंट्स के लिए भी कि आपका जो हैं, और पर्टिकुलरली दूसरे सभी स्टूडेंट्स हैं, कई स्टूडेंट्स ऐसे भी हैं कि जो मेल में ये पूछते हैं कि जैसे मेरा ये रैंक है, फॉर एग्जांपल मेरा 8000 रैंक है, एंड विल आई गेट दिस सीट, और विच स्टेट आई विल सीट। सो माय एडवाइस इज you just make a choice of your branch choices, college choices, and send me, so that I can give you a better advice that what would be the better for you, so that you can fill those choices in upward direction, or whether you have to think of the other choices, because at your rank those choices are not possible, so that I can give you a clear picture on that one. because similar, for example, Dr. Gitika wrote me a mail and she asking about the she want to stay in the northern India. So she asked about which branch I choose, and she's not alone. Many of you are asking this question also, that what branch I choose. So branch is definitely your choice may be dermatology, radiology, but at your rank you know that what is possible for you and at which branch you can get the admission, so that you can make a choice. Okay, at this rank, if I may get pediatrics in mop up, in earlier round I may get the TB chest, I may get the orthopedics, I may get the general surgery. So in these branches, these are my choices, these colleges are my choices, and if I get this choice and this branch, I'll go and I won't go. So it will be easy for you to have uh, in the counseling. And remember, what is, please slow down the comments. I will reply the comments also. Please slow down. What happens is, whenever in the top notch, student will get their choice branch, choice college. So that's a one pie. But majority of the pie will not get the choice college. Then there is a one pie also which won't get the choice branch also, but choice state available is them. So what is going to happen is, for example, I got a call today, so I explained this, and doctor was agree with me that one, for that one, because everyone want to stay in their own state, and to remain in the state, they may change the priority of their preferred branch. So what happens is, if this happens, then definitely, that's why I said in the beginning, when your counseling process was supposed to start at the beginning, that your round 2 counseling of the state will be crucial, and the mop up round counseling of the all India round will be crucial. A very questions which you people are asking, कि आप में से ज्यादातर कई बच्चों का क्वेश्चन ये भी आता है कि क्या मुझे मॉप अप तक रुकना चाहिए। तो अगर आपको अपनी चॉइस की ब्रांच या चॉइस का कॉलेज अपने स्टेट में मिल रहा हो, और आप चाहते हैं कि अब ठीक है, इससे आगे जाने से कोई बेनिफिट नहीं है, ब्रांच तो यही रहेगी, पर हो सकता है कॉलेज दूसरा स्टेट का मिल जाए, तो दैट अप टू यू, यू कैन टेक ए क्विट ऑन दैट पॉइंट। बट अगर आपको लगता है कि नहीं, मुझे मॉपअप तक जाना है और मेरी चॉइस की ब्रांच मेरे को मॉपअप में इजीली अच्छी मिलेगी और मुझे वहां जाने की है, तो आप मॉपअप तक भी जा सकते हैं। बिकॉज मॉपअप में जाना प्योरली आपकी चॉइस है। इट इज ए कैलकुलेटेड रिस्क विच यू हैव टू टेक। रिस्क टेकिंग इज योर्स। Advice is, at what rank or at what branch you can go to the mop-ups. That is, I have already replied on your mail IDs. तो ये इस तरह के क्वेश्चंस भी मेल में आए हैं, जैसा मैंने आपको बताया था। रजत गुप्ता, at your rank you will get your first choice branch in round 3 mop up, as well as your branch 2 also in mop up. Maybe branch 2 of your choice you may get it in round 2. That will be in the newer medical colleges, that's Sapali, Bhilwara, Bharatpur, Churu, Badmer, Sikkar. But in mop-up, your first choice branch, you may get it, Rajat, in your thing. Rajat belongs to EWS category. So EWS category question comes a very definitively on everybody's mind. And you all know currently constitutional bench is hearing the EWS matter. Today was the second day of the hearing. There will be 5 days of hearing and it may spill over to sixth day, and thereafter court will pronounce the judgment. So based on that judgment, the fate of the EWS will be decided. Many of the experts who believe that EWS reservation may go off, that is not my opinion. I am not of that opinion, though those experts are correct legally, because as per Indian constitutional, the provision of EWS reservation is not fulfilling. That's why last year, despite of court instructions to the government, okay, you decrease the limit, government did not budge. That's why this matter was linger on to this year. And this year, when the another bench about to hear the case and pronounce the judgment, then suddenly this matter was taken up by the constitutional bench. So this bench, in my opinion, is going to take a decision which will weaken the foundation of the Indira Sahani judgment, and based on that weakened foundation of the Indira Sahani judgment, uh, the further actions can be initiated on the other reservations also. So this is motto which I am looking at beyond the headlines or beyond the debates, because I am looking at the some remarks which were made during the course of hearing by the honorable judges. So I am looking at those ones. So EWS thing is entirely dependent upon the court's hearing. And if in any case, if you get the EWS reservation go, then definitely you will get 10% extra seats on the 10% extra seats on the general category seats. So that is there. Dr. Sagar, if you'll go up to the mop-up in your category, the branch which will be available to you are ophthalmo, psychiatry, ENT, and anesthesia. So these 4 branches will be available to you. So you can. So this is the reply to your mail. So I think you will be happy, Dr. Sarkar. In your category, up to mop up, these 4 branches will be available, and you can take it, and you can. You will be relaxed, and you can start your second phase of your career. You will get it, Dr. Sana, in your category at this rank. MGM is a bit difficult, but you will start from the periphery and you will reach to the Bhopal by mop-up. So at this rank, in your state itself, you will get the seat by mop-up in Bhopal. Dr. Kant, in your category, choice one may be a bit difficult, but other choices in pathology may be available to you. Yes, Dr. Biswas, in your category, at your rank, you will get your branch of choice, that is psychiatry. Like Dr. Pragya Seni, there are some students who are at the borderline of getting their dreamed branch because their number is false in the my analysis, in though they false in that range, but I took the mean number and that number is beyond that number. So maybe they won't get, but yes, in DNB they can get that branch. And So you have to think, when you select the DNB, you have to go through with the past percentage of the past, and also you must judge yourself that can you cope up with this pass percentage and you can prepare it. So maximum pass percent in the DNB is in clinical subjects in obs gynae, followed by medicine, then other branches, but very dismal percentage in the pediatrics. So, but on the other hand, Dr. Gupta, go for mop up. You may get it, but yes, your second choice will be available, and in the college of your choice. Uh, Super. Uh, it's very interesting name. Super Medico. Please write down your name at least in the mail. Yeah, you can change it name also in your YouTube ID. But okay. Uh, General surgery at this rank, probably you left the top-notch colleges of states, all the states, and you can get it the general surgery in the peripheral colleges of all the states. And if I'm at your place and I want to choose the general surgery, then I'll not go for the central colleges. I'll go for the peripheral colleges where I'll get more hands-on practices. So, Super Medico, if I'll at your place, then definitely I'll target the good peripheral colleges so that I can get a good, handsome, hands-on practice, which enable me for a better start immediately after my completion of MS degree. So that's my advice. So you can go through it. AC EWS category. Let's wait for the court result. But yes, it is possible, and mop up. Don't worry. This year, number of seat increment in the radio is nearly 100, 200, nearly 200, 196 or 192 or number. I have to check it again. Mona Lisa, if you go for the dermatology, then yes, it will be available to you. No issue in that one, and that will be available, probably available in round 2 in the periphery of the India. But in mop-up, you will get upgradation near to your home or choice. Maybe you will get your choice of college. And as far as the radio is concerned, at your rank, you have to wait for the mop-up, so that in mop-up, definitely mop-up will be a good round for you to go for the radio and derma at your rank. Maybe you are from West Bengal, so definitely in West Bengal you will get it. there in this one. Yes, Tarun, in UP. Yes, mop up in UP. That's in, because in new colleges also seats have added on. So don't worry, Tarun. I'm replying from the mails, because many mails are pending in my mailbox. So I thought it will be good for me uh, to reply you. Suvam is very curious about the number of seat increment in the Odisha. Uh, Suvam, I miss your rank in your trail mail. In the new medical colleges of phase 1 and phase 2, Odisha have 2 or 3 colleges, and all those 2 3 colleges are going to get PG seats from this session, Suvan. So if you are from those districts, then definitely you are going to get PG seats in those districts. And I'm missing your rank in my trail mail. So if it is I get, then definitely I'll reply on that one also. Dr. Salja, if you are interested in medicine, then wait. But if you can take pediatrics, then you go for in round two of Maharashtra state as well as in all India. It will be easy for you to take pediatrics over there at your rank. And remember, all dear all, um, pediatrics medicine and general medicine are almost similar. Difference is in pediatric medicine, the concept of super specialization is very, very new, and it's specific to the neonatology. But other super specialization in pediatrics, which is course, are available in CMC Vellore, and some courses available in PGI Chandigarh are still in very, very infancy stage. So after MD Pediatrics, you can kick start your career. And for MD Medicine, you can you can if you want to do a super specialization, then definitely many more avenues are available, and you have to study for 3 more years. Another thing about the advantage of pediatrics is, if so, for example, I did my MD in MD pediatrics and now I want to go for medicine practice. So what I'll do is I'll attempt a super specialization examination. I'll get selection over there, and after that, I'll get a super specialization degree, and I'll enter into the medicine branch, and I'll start my practice after completion of super specialization. So you will have a chance to return to the fold of medicine after completing a MD degree in pediatrics. So, if I am at your place, then definitely I'll go. And if you are interested in Maharashtra, then definitely my advice is get it in state or All India Quota Counselling. Go through the pediatrics and complete the course. And if you want to, if you want to come, if you want to study more, then you can study further. Dr. Siritha, last year and this year, difference is number of seat increment. In your category, The seat increment is also good, and seat increment in the general category is also available. So that's why I mentioned you in my mail reply that you will get the options luxury of ortho, OBG, general surgery, ophthalmo, psychiatry, ENT, and anesthesia at your rank in different rounds, from round 2 and mop up. In round 1, start from anesthesia or ENT, which will be upgraded to ophthalmology, general surgery, psychiatry, orthopedics in different colleges. Maybe college is not of your choice. Then when you will go further in the mop up, then definitely your college in your selected branch will be upgraded. So this is the reason. So don't get surprised that why I have given a wide variety or wide range at your rank, and you thought that this is not possible because last year it was not so the case. So MBBS 2020, I have replied the query in my opening remark. I think you got it. So Rahul, Neet PG 2023 notification. I don't know why that has been stuck. Even my sir is saying we have already cleared everything. For example, in Rajasthan government has cleared all the formality, financial approval, everything for the new MOs posting, 856 posts of new medical officers, and they have passed on their sanction to the examination authority, that is Rajasthan University of Health Science, 2-3 months back, but still they are not conducting examination. They have not issued the notice. That's why government of Rajasthan intervened 10 days back, and they have wrote a letter to the RUHS and asked them to fill those vacancies ASAP. In reply, RUHS said that we will do it before 31st of December. We will give you the desired number of candidate to you, because number of vacancies also increased. So that's why government is becoming restless. Similarly, in 2023 notifications, need not to worry, it will come. Keep studying. As I mentioned, 4th Sunday of the January is the date. If it is postponed, then postponed not more than 3 weeks. And that has been reiterated in the Supreme Court also, if I'm not wrong. Dr. Ahana, yes, round 2 onwards and mop up upgradation. So if round 2 you get your desired college, so you make a list of 10-15 colleges in which you will be comfortable. You won't face any linguistic problem, because in general medicine or in medical branches, you must choose those colleges only where you won't face any linguistic problem. Then you choose those colleges, make the list, send it to me. I'll help you to rearrange your choice, fill the choice, get the desired college in round 2. Probably in round 2, in 2% chances you have to go to mop up for your desired college thing, and you can start your career in general medicine. Dr. Ahana. Ritik, you will get it. You will get it in mop up. From which state you are? I don't know. Probably you are from Uttar Pradesh or Haryana or Rajasthan or Madhya Pradesh. So you won't get in Uttar Pradesh at this rank. Okay, you are from UP. You won't get in UP, but you will get it in Rajasthan. You will get it in Gujarat. You will get it in MP. You will get it in Chhattisgarh. You will get it in Jharkhand, this Jamshedpur Medical College. So orthopedics, you will get it at this rank in mop up. So you have to go till mop up to get this your desired branch. So I think Ritik, you are satisfied. No, 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 no. Dr. TV. Dr. TV Kunal Chauhan. Your name is good. Dr. TV Kunal. Kunal, Dr. Kunal, at this rank category, at this rank, medicine is a difficult prospect, but yes, in mop up, in very peripheral colleges, you may get pediatric medicine. Alternatively, you can go for the pulmonary medicine, or if you want to go for surgical branches, those all will be available to you. So, and psychiatry will be available to you. So, general medicine MD is difficult, but yes, DNB, if you want, if you can cope up with that tension, though DNB pass percentage in medicine is more than 85%, you can get it. So, Dr. Kunal, this is about your mail query. Yes, Dr. Aniket, don't worry, you will get it. Dr. Aniket, don't worry, you will get it. Dr. Naresh, first choice, sorry, and I'm not advising you for go for the DNB in your first choice until unless you have a very good backup in the family, and if it is compulsion in the family, then you can go it with a lot of arrangements. Otherwise, your second choice is good, and you will get it in round two and mop up a good college of your second choice, Dr. Naresh. So, need not to worry. Dr. Mahima, I don't know about your attempt. If it is your first attempt, then my advice is go for at least you must take second attempt. If it is your third attempt, and if you are looking second or third attempt, you are looking at this diploma seats in the branch. Even you can get it diploma, DNB diploma, NBMS diploma in pediatrics and gynae in your state choice of your state. But remember, Mahima and everybody, well, if you choose any seat and you join, then you will be out of the counseling for the next 2 to 3 years, depending on diploma or degree. Whether it is DNB, whether it is MDMS, whether it is diploma degree. So that's depend upon that one. So join the college, join the seat when you are completely satisfied and you want to join that one. Why not? If I'm not wrong, then you may be from Haryana. Even you can think of PGIMS in mop-up at this rank. But if you're from Rajasthan, don't worry. Don't worry. You will get it. Dr. Chanu Mehla. Dr. Aniket, I have replied your query already. General surgery, round 2, Dr. Nishant, round 2. onwards, round 2 you will get a good college, and in mop up it may be improved, but that will be at par of your round 2 college. Probably in round 2 itself you will get a good college where you will get a good hands on practice in surgery. Dr. Kunal, I will reply your mail in words tomorrow. Is it okay? Uh, because you sought another mail, so you have already shoot another mail. Amazon mail. Now come, I have to take some comments also. BJ Medical, my mail ID given in beginning, so you can go through it. But I am posting here again, commenting, so you can send a mail. So tomorrow I'll reply the remaining mails also, which I didn't reply that one. Uh, no, Ramkumar, Ramchandran, even DMRD at this rank is a distance possibility. Yes, Acharya, my answer is affirmative to your query. Uh, Chanda Shekhawat, DNB General Medicine in North India is possible, but not MD General Medicine at your rank. Yeah. Dr. Sonika, this is a very good general query. Very good. Excellent. Dr. Sonika, the seats of private medical colleges will be for the respective state counseling. As you have seen in the Tamil Nadu, Odisha, Madhya Pradesh, Kerala, or Chhattisgarh case, UP case. But in case of deemed universities, the fees will be determined by the state fees regulatory committee of that particular states, but all the seats will be filled up by the All India Quota Counseling, be it 50% seats at par with the government fee rate, and 50% will be the at par with the exuberant fees. And that's why, you know, um, question the already the maths is explained to the private medical colleges. That's why the Madhya Pradesh notification have mentioned it, and you have got the hint also. NRI quota fees is four times of it, private in private medical colleges. So four times mean four student fees. If a 15 student out of 100 are NRI, then 60 seats normal student fees. Now they have to fill 40 students at government fees. So still they are in profit for those 20 seats, and seats also increased. So that's why on throughout my lives, I'm always saying NMC is going to implement. NMC is going to implement, though many of you are shaken by the different YouTubers, but my opinion is firm, not moving. And my opinion is you will get 50% seats. That is practically you will get 42% seats at par with the government quota fees in the private medical colleges. In gynae ops, Dr. should be gynae ops the seat increment in three digits all over India. Mid three digits, initial three digits, not to 1,500 something. Crazy girl. Maybe I replied Crazy Girl about this query which Dr. Arora asked, and I replied. Uh, Yasmin, yes, in Shamsa Medical College or Gwalior Medical College in Mop-up. Forget about the new medical colleges. Your choice, branch choice. Dr. Ramchandran, I have replied your query. Dr. Sonika, counseling from tomorrow. No registration. Counseling, the choice filling will start only after the EWS decision. EWS decision is very critical. The matter is stuck over there, and constitutional bench have to give decision. They can't linger on, because if they linger on, then Justice Chandrachud may steps in his case, because still it was not stopped by the constitutional bench also about this one. So different situation may come up. So to prevent that, this bench have to give a decision verdict in week of 19th or 20th September. So thereafter, your choice filling will start. Dr. Acharya, yes, ophthalmology, I told you, don't worry. Doctor, DNB OB-GYN is possible, OBGYN possible, uh, but I don't know whether in a government college or government institute or not. But yes, OBGYN DNB is possible for you, and DNB OBGYN has the maximum pass percentage, which is always crossing 90%. So this is a very safe DNB if you want to pursue. Dipankar, I got your mail and I replied. I will check this outbox and I'll resend again to you. BJ Medical, I think you are from Gujarat. And you are studying in BJMC. That's why I wrote the BJ Medical. Uh, So, and once you post your comment in the comment section, you are doctor, yeah, you just post it once. I'll go through the comments, and you are posting 3, 4, 5 times. So others' comments are get hidden, and those people are getting more anxious. Sukanta, don't worry, Sukanta, you will get it. Dr. Swam, all over India, this is going to implement. Don't worry. DNB at this rank, Dr. CV, DNB Pediatrics, where it is DNB Pediatrics, bit far, both are bit far. You have to think for optho, MS, optho, ENT, psychiatry. You can choose the 6-year course also in DNB. ST, don't worry. So chance of postponement of counseling, as I mentioned, Arvind, don't post your queries again and again, Dr. Arvind. I have already read that query. So counseling will be start only, the choice filling only start after the completion of the EWS hearing and result of the EWS case in the Supreme Court. DNB medicine, emergency medicine, yes, DNB. But Dr. Yadav, remember emergency medicine DNB pass percentage is very dismal. So you have to be careful. But DNB in general medicine in Delhi at this rank maybe plus minus, but outside Delhi is possible. Uh, at this rank, pediatrics for Dr. Madan DNB, uh, it's a on outside range. Surgery, yes, you will get it, and DNB surgery at this rank you may get. Um, yes, Dr. Patel, this is a very good question that how the fees will increase. The fees increment in the remaining 50% seat is not too much. It is not too much increment in the remaining 50% seat because they have to consider the NRI fees, they have to submit the MBBS fees. Why I'm saying is in MBBS the fees is high. In MBBS for 50% seats, fees is as high as 7,75,000 rupees, and minimum fees will be 3,50,000 in some states. So MBBS fees is on higher side, but postgraduate seats are not. Why? Because many states have started the society medical colleges, and in those society medical colleges, state is charging this much of fees. So private medical colleges have the luxury to claim that fees, and that has been granted to the private medical college in the MBBS. But in postgraduate, this is not a scenario. That's why the postgraduate fees will be less in those 50% seats, but 50% seats in the undergraduates, the fee will be ranging from 350 to the 775 or 792 maximum for that one. And in MBBS seats, a particular peculiar case is Kerala. In the undergraduates, Kerala already charging, giving admissions on the government quota fees, and that is fees decided by the government. So probably they're all seats at the same fees. They will get admission 6,16,000 to the 7,90,000 different seats. Maybe some variation in the higher category fees where they're charging 825, they have to charge 50% quota fees on 616, but remaining fees on 825. So that there will be very little change in the Kerala MBBS UG fees, but in other colleges, the fees structure of undergraduate is bit different and on higher side. Uh, Dr. Shubhi, yes, I already replied your query affirmatively, and you will get it in North India. Don't worry. At 7.9, if you are looking at Dr. Siri General Medicine in Southern colleges, so I don't know about your state, but whatever state from you are, you will get in your own state at this rank General Medicine by round 3 mop up. Round 2 in Southern India settling itself, maybe you will get in your own state, but yes, after round 2 you will be settled down in your own state in mop up. Dr. SP, at this rank, mop up, go for mop up, take this seat of your choice. College may be not of your choice, but branch of your choice, you will be available at this rank. Slow down your comment, please. MK, yes, DNB, you will get it at this rank in mop up, not before mop up. Rahul, Srivastav. EWS, can we wait for the final outcome of the EWS case, which will be in favor of the EWS category, I believe, though experts are saying on the other side of the thing. My belief is EWS reservation will stay and it will not go off easily. And at your rank, it is plus minus, you will get the seat in general surgery, but that will be in the Eastern India. Yeah, Dr. Gamma Knife, you are doing Gamma Knife and you are looking for the orthopedics. Your name suggests you want to do neurosurgery, and you are looking at the this one orthopedics, but possible, not possible at your rank. Anesthesia, yes. Civica, anesthesia is possible, and maybe you may get ENT also in mop-up. Mop-up is very important for the all India. I told you, it will be very surprising. Dr. Barry, start preparing for the 2023 examination. Uh, Dr. TG. Yes, my answer is affirmative for the government college, but I don't know from which state you are. So once I know about your state, then I'll tell you about more about your query. Aditi, then oh, why not? And in round two, yes. In your own state, yes. Huh? Uh, coming in 5 minutes. Jasjit, it's a bit difficult. You may, but you may not. But it's difficult because that's a very popular branch. You know, though seat increment is very minimal. Another reason is in psychiatry, the seat increment is in 2 digits, so it's very dismal increment in psychiatry. So that's why, and even there's no increment in the private medical colleges. So, so that's a very bleak scenario over there. Sumit, orthopedics in your category, yes, you will get it. You will get it in round two. On round mop up, definitely yes. Round two, you will get it outside the North India, but in mop up, you will come in North India. Akash, yes. Affirmative. Yasmin, mop up. Affirmative. Ayan Ahmad. This is a very good query, Ayan. And you are not a single one to pose this query. Those students, now again I am repeating, please slow down your comments. Please, those students who got the seat in 2021 and got a good rank again in the 2022, definitely you are eligible for the counseling after resignation from 2021 seats, after paying the desired penalty fees. But in case of diploma, this desired penalty is very less. So if you leave that, and if you got an NBMS diploma, then no penalty, you just leave there, come and join your MD or MS branch which you want it. But so that's, you can, Ayan, you can join it, no issue in that one. So this is all from my side, and from this point onwards, whatever mails comes to me, I'll reply it tomorrow morning before noon. You will get my reply on the mail, and my mail ID again I am posting over here. Though I am getting mail during my live conversation also, I will reply those mails also, and those mails which are still stands unreplied in my mailbox, I will reply those mails also. So by noon or 1 p.m., you will get my answer uh, from my side. So that's all from this. Subham Saurabh, what's your query? OBC quota, state quota in possible, yeah. Subham, I told you, na. In, in affirmatively, I got you. Some students are FMG students get a good rank, so they will get the college in good states also. So don't worry. So I will reply all the mails after this point. And thank you very much for your patience. And I think you all will be relieved by this some sort of anxiety which you are facing on. And today weather was very good, and still it's a very good. Cold winds are blowing. These winds are these winds. I must say this is for yourself to keeping you cool down, because you are getting a handsome number of seat increment. You are getting a 50% private medical college seats, and your new phase of your career is going to start very soon. So Dr. Pritha, yes, my answer is in affirmative in mop-up. You will get it in your state. So maybe before mop-up in round 2 also you will get the seat affirmatively in your state. College may be your periphery in your state. So this is all from my side. So Dr. Sahu, if I summarize the today's thing, so I shared the first series of the full first part of the test 1 of the full syllabus, which comprises of 50 questions, one liner questions also, image based question also, and integrated questions also. So I will post the next 50 questions of the part 2, which we can say part 2 of the test 1 will be posted tomorrow. I start number 51 to 100. Thereafter, I'll post the answers immediately so that you can go through those questions. Neet PG 2023 is going to happen probably, if it is postponed, not more than 3 weeks. So keep on preparing. INICET examinations is coming. That's why I start posting this one, and I'll post the PSM video next week, early next week. And probably one more thing, I probably at the end of the month I may come down to the south for 3 days. So that is there. And as far as your queries are concerned, are replied. 50% seats of the private medical colleges are going to come in your kitty at government fees. Postgraduate fees will be very less, but undergraduate fees will range from 3.5 lakh to the 7.75 lakh in different states, different fees. But in some states, still the fees will be less for the 50% private quota seats. So before filling up the counseling, you must know about the fees. Follow the NMC guideline. Don't share your username password with anybody, so that nobody will play with you, because this time penalty will be hefty and penalty will be sure. So this is all about from my side, and thank you very much, and have a nice day. Enjoy your life, enjoy your days, coming days, and keep brace yourself for your new opening for the 2022 successful candidates, and tighten your seat belts who are preparing for the INICET examinations, because your examination is approaching in November. Thank you very much. Goodbye.